This year has been a very exciting year in that we had two really important studies that were reported that help us add to the therapies that we have to offer to our patients with advanced neuroendocrine cancers. And so we talked about those. We talked about the heterogeneity of this patient population, where some patients may have slower growing cancer and other patients may have disease that is a little bit more aggressive. But these studies were really important. The first one was the CABINET study, and that was a therapy of an oral tyrosine kinase inhibitor, cabozantinib, and it was randomized to patients in a 2-to-1 fashion. And those patients actually had been heavily treated before. So this offered an additional therapy for patients that have already been on somatostatin analogs, everolimus, and other treatment options. And that was a positive study that was reported for both pancreatic neuroendocrine tumors as well as the extrapancreatic neuroendocrine tumor cohort. So both cohorts improved progression-free survival when taking cabozantinib. So we're really excited about that study. The second study was NETTER-2, and NETTER-2 used lutetium-177 dotatate, also known as Lutathera, and that was actually in patients with higher grade disease, intermediate and high grade tumors that were up to a Ki-67 of 50%. And those patients were randomized to either receiving the lutetium-177 dotatate plus octreotide versus the cohort of patients with high dose octreotide. And again, that was a positive study, thankfully, and those patients had a progression-free survival of remarkable 22.8 months, with a response rate that was actually quite high of 43% as well. So two very exciting trials that showed that we have additional treatment options for our patients.